This is TechCrunch. Dr. Tom Kelly is a trauma surgeon, and everywhere he looked, he saw doctors drowning in administrative work. He wanted to change that, so he set out to build it. He told TechCrunch, "We wanted to build an AI care partner that would stand alongside clinicians and take care of the admin so that individual providers can feel empowered to deliver the care which we dedicate our lives to." Dr. Kelly teamed up with Walid Musa, with whom he had worked at a previous startup, and founded Heidi Health in 2021. The company began launching products earlier this year. In just 18 months, he said the company has returned more than 18 million hours to frontline healthcare providers from more than 70 million patient visits in 116 countries. The product, as promised, is an AI medical scribe that takes care of all the admin work that hassles doctors. It can transcribe and dictate notes, generate personalized patient summaries, and even track tasks so doctors no longer have a need for sticky notes. Heidi both built its own AI model and built on top of other models, such as Gemini. Kelly said, "This model agnostic approach means that we can optimize our accuracy, latency, and cost." On Monday, the company announced a $65 million Series B, led by Steve Cohen's Point72 private investments. It also announced a new tool, an AI agent that calls patients on behalf of the doctor. The former chief medical officer at Microsoft, Dr. Simon Coase, is also coming on board, along with Plaid's head of revenue, Paul Williamson. The company has raised $96.6 million to date. Others in the round include Goodwater Capital, Headline, Blackbird VC, LG Technology Ventures, and Alumni Ventures. Dr. Kelly said of Point72 private investments, they had seen all the scribes before. They'd never seen product adoption and usage metrics like they'd seen in Heidi. They also loved that we were obsessed about the end-user experience because they saw most of our competitors were just doing top-down sales. The fresh capital will be used to help with product development. Dr. Kelly hopes that giving doctors more access to AI tools will expand the capabilities of clinicians and remove the drudgery of their work. He said most of the conversations in the medical world right now are shaped by what is happening in developed countries. But imagine a world where any healthcare provider in the world can use Heidi to increase their clinical capacity, where they can practice in a war zone or a refugee camp or a region hit by climate change or simply an underserved community. Heidi can help them reach more patients and deliver better healthcare results. AI is transforming health tech. Others in the medical scribe space in particular include DeepScribe, Ambience Healthcare, and Abridge. Heidi says it works with more than 2 million clinicians a week, ranging from hospitals to individual practices. It has a free version of the product with paid features, which Dr. Kelly believes has been a good lure for new customers. He said, AI is understandably going to change everything in healthcare, but at its core, humanity is still very essential, especially when it comes to maintaining and building trust. He said, "It's about doubling the world's healthcare capacity. That's the true promise of AI. And we want to bring it about." Sheena Jindal is from Boston. She grew up there, attended MIT, and worked at the Boston Consulting Group for several years. She launched a startup, worked at a startup, and then became an investor at Bessemer and Comcast Ventures. Last year, her worlds collided when she decided to launch her own fund, Sugar Free Capital, a firm that focuses on investing in technical founders from MIT. She nabbed LPs, including the family offices of heavy-hitting tech executives from companies like NVIDIA and Citadel, and on Monday announced the closing of Sugar Free's $32 million inaugural fund. One premise of the fund is found in the name. While working at CV, she led dozens of deals, but found herself dismayed at the sky-high valuations of the 2021 era. She kept referring to investment opportunities as being too sugary in the sense that valuations were too high. From there, she started thinking about the innovation of the past few years and how it was focused on optimization. She designed a thesis around the idea that capturing the age of intelligence would require two things: technical founders, predominantly those with a systems engineering mindset, which is what MIT brings. She said, "The data have shown us historically that venture returns are concentrated among a select group of winners." The focus on MIT also has another reason. Unlike Harvard and Stanford, there isn't a big class of MIT alumni who are early stage investors, even though MIT founders often go on to start and work at lucrative companies. She said, MIT folks go into finance, but they go into more quantitative roles, more hedge fund and late stage investing. That white space gives Jindal, a rare solo woman GP, an outsized opportunity. She plans to invest in 15 early stage companies. She's already backed 4, writing checks that range from $1 million to $5 million. The firm focuses on AI native infrastructure and picks a new theme each quarter to focus on. For example, this quarter she is looking for companies focused on physical AI, data center optimization, and AI agents. Sugar Free has already backed a defense company, a gaming company, and a company in workflow automation. Jindal hopes to cut at least 4 to 5 checks a year. Much of the inbound is from her reaching out to founders or referrals, but she's open to cold outreach. Overall, she feels lucky about this fund. The fundraising environment was and is hard for many GPs, especially solo ones, and especially women. She said LPs liked that her firm provided good access to MIT talent and had a clear thesis. Jindal said, "We are in the transition period between this new world order of AI native technology and the infrastructure and business models of the past." She's excited to see how they're able to harmoniously combine those two in terms of infrastructure, technology, and the human experience. That's it from TechCrunch. For more tech stories like these, go to TechCrunch.com.